Hi guys, anyone who is preparing for the PLAB 2, I just want us to look at the importance of exploring the patient's eyes. Okay, so if you want to improve your data gathering score or mark, there are a couple of things that you really need to pay attention to. In addition to exploring the symptoms in terms of, the history of presenting complaints, something that is so important is exploring the patient's ideas, patient's concerns, and patient's expectation or expectations. So what does it mean? In the process of taking your history, you need to be asking the patients questions like, what do you think may be responsible for this pain? What do you think maybe, may have brought this cough on? What do you think may have, caused this, this arm weakness or this leg weakness? So checking what the patient thinks. Of course, every human being has a brain, so the patient would have thought about something. Oh, maybe I hope it's not this. Oh, it could be this. Or the patient may have read from the internet, or the patient may have heard from their relatives that, oh, this chest pain you're having, it sounds like this pain you're having could be a heart attack, or this pain you're having, or this palpitation you're having could be a heart problem, so the patient might have an idea, and you want to ask them, what do you think? Or have you thought about anything that could be causing this symptom? So that's the idea, okay? And in your history, you want to also ask questions about their concerns. Are you particularly worried about anything? Are you particularly worried about anything? Are you worried about anything in particular as regards this chest pain you're experiencing? Person might tell you, oh yeah, I'm just really worried, or a part of me has really thought that maybe this is a heart attack, or maybe this is a problem with my heart, and then you want to find out why they think that way. Okay, maybe they lost a relative, or maybe they lost their dad to a heart attack, or one of their uncles to a heart attack, and you want to find out. And then you ask them their expectations. So what were you hoping for today? Okay, when why booking these appointments, or why coming today? What were you hoping, would be done for you, or how are you hoping I would be able to help you today? So their expectation. So you want to ask their ideas, you want to check their concerns, or ask about their concerns, or you want to check their expectations. Okay, because when you go to the management of that patient's symptoms, which is the last part of your your assessment, you will need to be bringing in the ideas, concerns, and you need to be saying things like, oh yeah, I agree with you, this sounds like a cardiac pain, or this sounds like a pain that's related to a heart problem. I think we need to be investigating further. So you're bringing in the idea. The patient says, or maybe they think it could be a heart problem. You're saying, oh yeah, I agree with you. But you want to be, contradicting, the ideas by saying, by saying things like, oh, I don't really think, I know you're worried about, or I know you think it could be a heart problem, but from what you've told me and from my examinations, I really don't think this is a heart problem. Okay, so you're bringing in the ideas in your management, you're discussing, diagnosis of management, and then you say, okay, maybe expectations. Yeah, I know you came here today hoping to get a scan, okay, of your tummy. And I think that sounds reasonable. However, I think we can actually do some, some more simple investigations like blood investigations, and then wait for the results to come back. Then we can have a chat as to whether it's absolutely necessary to get a scan or not. So you're bringing in their ideas, their concerns, and their expectations into management. And I assure you, if you're able to do this in your PLAB 2 examination, you will score very high in both your data management and even your management, because you brought in the patient's eyes into the management, and even your interpersonal skills will all be skyrocketing. And I assure you, you're going to score excellently well in all your stations in the PLAB 2. All the best. Wish you success. Bye.